If you're one of the millions of people around the world who regularly takes a supplement, chances are pretty high that you have a bottle of vitamin D sitting on your shelf.
Oh, absolutely. It's one of the most common supplements globally. And yet, there's this surprising thing we found in our sources.
Yeah, that a huge number of people are actually taking it incorrectly.
Exactly. Too much, too little, maybe even the wrong kind. It's this simple nutrient, but it gets complicated fast.
It does. So our mission for this deep dive is to just cut through that noise. We've gone through the research, and we want to distill what you actually need to know.
We need to get clear on what it does, who really needs it, and maybe most importantly, that line between a safe dose and the risk of an overdose.
Okay, let's unpack this and get specific. So before we get into the numbers and the doses, let's just nail down what this stuff actually is. We call it vitamin, but that's a bit misleading, isn't it?
It is, yeah. Chemically, vitamin D is a group of fat-soluble saccharides. It's a nutrient, yes, but once it's in your body, it's converted into a hormone.
And that term, fat-soluble, that's really important here.
It's critical. Unlike, say, vitamin C, which is water-soluble, your body can't easily get rid of excess vitamin D. It stores it in your fat cells.
Ah, so it can build up over time?
It can build up, and that's the first real signpost pointing toward that toxicity risk we'll get into later.
Got it. So what's its main job? What is it actually doing in there?
Its core function is to be a helper. Think of it as the facilitator for calcium.
Okay.
It basically unlocks the door that allows your body to absorb calcium and phosphorus from your gut. You could eat all the calcium in the world, but without enough vitamin D, you won't actually use it.
So no vitamin D means weak bones and teeth, even with a good diet.
That's the bottom line. It's the key to that whole system.
So where do we get this helper from? I know there are three main ways.
Right. The first, and best known, is sunlight. UVB radiation hits your skin, and your body just makes it.
The natural way.
The natural way. Second is food, but honestly, not many foods are naturally rich in it. You're talking fatty fish, some mushrooms, fortified milk.
And the third, of course, is supplements, which is where a lot of the confusion starts.
It is, because you go to the store and you see two different kinds on the shelf.
D2 and D3. Is there really a difference?
Oh, a huge difference. And this is really where the details start to matter. Vitamin D3 is cholecalciferol.
Right.
It's chemically identical to what your body produces from sun exposure. The general consensus from all our sources is that it's more effective at raising and maintaining your blood levels.
And D2?
D2 is ergocalciferol. It's usually derived from plants. And, I mean, it works, but D3 is almost always the preferred form for supplementation.
And just as a quick practical tip for you listening, you might see brand names like Nature Made in the US or Vigantal in Europe or Calcerol in India. But the key is to just look for that D3, the cholecalciferol, on the label. That's the active ingredient you want.
Exactly. And the last thing to remember about how it works is that it's not a painkiller. It's not an instant fix for anything.
It's a long game.
It is. It works slowly, quietly, steadily in the background. If you start today, you'll feel the benefits to your bones over months, not hours or days.
Okay, so since it's so critical for using calcium, let's talk about who needs it most. Its main job is bone strength, we get that. But why is deficiency so incredibly common?
Well, it's really a problem of geography and lifestyle. The sources are pretty clear on the groups most at risk.
People who stay indoors a lot, I'm guessing?
That's the big one. Also, people who actively avoid the sun for very valid reasons like skin cancer concerns. And then there's location.
Right. If you live somewhere with long, dark winters.
Yes. If you live in the northern latitudes, you might get almost no useful UVB light for half the year. Your body's natural production can literally shut down in the winter.
I'm hearing that it's vital for bones, but, the way it's marketed online, you'd think vitamin D is this miracle cure for everything. Mood, colds, fatigue. What did our sources say about those claims?
That is such an important question. The science is supportive, but it's not miraculous. It is absolutely not a cure for depression or chronic pain.
Okay.
It does support your immune system, sure, but you shouldn't be taking it thinking it's going to replace, getting a flu shot or washing your hands.
Yeah.
The strongest evidence, by far, remains with skeletal health.
And within that, there are some really powerful preventative uses.
Yes, definitely. It's widely used to prevent osteoporosis. That's bone thinning, which is a huge issue, especially for older adults.
And that ties into muscle strength too, right?
It does. Good supplementation has been shown to improve muscle function, which then directly lowers the risk of falls in the elderly. That's a big deal.
So if we connect this to the bigger picture.
The bigger picture is that it's a vital part of the system. It helps everything run smoothly. But it is not a replacement for medical treatment for a disease you already have. It's one essential piece of the puzzle, not the whole picture.
That distinction is so important. Okay, now we're at the sharp end of this, the dosing. This seems to be where everyone gets lost.
This is it. This is where most of the incorrect usage comes from.
So for a typical healthy adult, what's the standard daily dose?
The general consensus we pulled from the sources points to somewhere between 600 and 800 international units a day, or IU.
600 to 800 IU, that's the daily maintenance dose.
Correct. And then we have the hard limit, the number you should not be crossing regularly without a doctor's supervision.
And that is?
4,000 IU per day.
4,000. Okay, so that's the absolute ceiling for daily use without a doctor.
Exactly. Regularly going over that for a long time is where the risk for toxicity really starts to climb.
And this is a huge source of confusion. You go to the store and you see different units. You see IU, but you also see micrograms.
MCG, or the little Lig symbol. This is a massive reason people overdose accidentally. You have to know the conversion.
What is it?
The essential rule is 1 microgram equals 40 international units. 1 milligram is 40 IU.
Whoa. Okay, so if someone sees a bottle that says 100 milligram, they might think, oh, 100, that's a small number.
Precisely. But 100 micrograms is actually 4,000 IU.
So they'd be taking the absolute maximum safe dose every single day, thinking it's a small amount.
Yes. Misunderstanding that simple conversion is a direct path to accidentally overdosing, especially if you're also drinking fortified milk or eating fortified cereal. You have to know the units.
Okay, here's where it gets really interesting for me. If 4,000 IU is that hard limit, why do we hear about doctors prescribing these massive doses, like 50,000 IU a week? How does that not cause immediate problems?
Right, that brings us back to personalization and duration. Those huge doses are what we call a loading dose.
For what?
For someone who has been tested and is found to be severely deficient, a doctor might prescribe 50,000 IU once a week, maybe for 8 weeks, as a medical intervention.
So it's not a maintenance dose. It's a short-term, high-intensity correction to fill up a dangerously empty tank.
Exactly. Once their blood levels are back in a healthy range, that high dose is stopped, and they're dropped back down to a maintenance dose, like that 600 to 800 IU we talked about.
So the big takeaway here is more is not better, and you should never, ever self-prescribe those megadoses.
Never. That's a decision that has to be based on blood work. And following that thread, we should probably transition right into the risks of using high doses long-term, which again comes back to it being fat-soluble.
Right. We know that a low daily dose, under 4,000 IU, is generally safe for long-term use, but you have to be careful if you're on anything higher.
Absolutely. If you've been on one of those high corrective doses for several months, you have to check in with your doctor. The toxicity doesn't happen in a day. It happens because your body keeps storing the excess in your fat and liver tissue.
Okay, let's talk about the specific side effects. At normal doses, they're pretty rare, right? Maybe some mild stomach issues.
Very rare. But the risk from overdose, while not common, is serious. The actual harm isn't from the vitamin itself.
It's from the calcium.
That's from the calcium. The danger is a condition called hypercalcemia. Too much vitamin D means your body absorbs way too much calcium and your blood becomes flooded with it.
And what does that actually do to a person? What are the symptoms?
Initially, it can cause some really unpleasant things like severe nausea, vomiting, constipation, and just a general feeling of weakness.
Okay.
If it progresses, it can start to affect your brain, leading to confusion. But the most critical danger is to your kidneys. All that excess calcium can damage them, potentially causing long-term problems.
So that list of symptoms is a really important checklist. If you are taking vitamin D and you experience ongoing nausea, unusual thirst, weakness, or any confusion,
you need to talk to a doctor immediately. Those are the red flags for high calcium, and it needs to be addressed right away.
Now, moving beyond the general rules, things can change a lot depending on who is taking it. Let's run through some specific populations.
A good idea, because the risk and the need definitely shift. For children, for instance, they can absolutely take it and often need it, but the dose is very different and has to follow strict, age-appropriate guidelines.
Much lower than for adults.
Much lower. Same for older adults. They get huge benefits, especially for preventing falls, but they can also be more sensitive to high calcium levels, so they should avoid high doses unless a doctor specifically recommends it.
What about for women who are pregnant or breastfeeding?
It's usually safe and often encouraged, because both mother and baby need it. But the exact dose is non-negotiable. It has to be discussed with a healthcare professional.
And it's not just about who you are, but also what else you're taking. Or drinking. What about alcohol?
An occasional drink is fine, but the sources suggest that chronic, heavy drinking might interfere with how your liver metabolizes vitamin D, making the supplement less effective.
So you might need a higher dose to get the same result.
You might, and that would need to be monitored.
And then there are prescription drug interactions, which sounds like a critical safety check.
It is. Several types of medications can directly affect vitamin D levels. Certain steroids can reduce calcium absorption. Some seizure medicines can actually speed up how fast your body breaks down vitamin D.
Oh, interesting. So your supplement becomes less effective.
Correct. And then some weight loss drugs can block the absorption of all fat-soluble vitamins, including D.
So you're taking it, but it's just passing right through you.
Pretty much. So the takeaway here is really simple, but it's essential. If you take any regular medication for a long-term condition, just mention that you're also taking vitamin D to your doctor or pharmacist. It's a quick conversation that ensures everything works safely and effectively.
So what does this all mean? We've covered a lot of ground, and it's definitely more complex than just take a vitamin every day.
It is. This deep dive really shows that vitamin D is simple on the surface, incredibly helpful for bones and muscles, but only when it's used correctly.
Thoughtfully.
Thoughtfully, yes. Understanding the difference between D2 and D3, knowing that crucial conversion between IU and micrograms. That's the key.
And holding on to that 4,000 IU daily limit as your guardrail, unless a doctor tells you otherwise based on your specific situation.
Exactly.
And that's the perfect note to end on. We've laid out the general rules, but let's leave you with one final thought, something to really chew on that builds on this idea of personalization.
Right. Consider this. Since all those individual factors, your diet, your age, your health conditions, and especially how much sun you get, all matter so much.
The ideal dose of vitamin D is fundamentally unique to you.
It is.
So think about your own life. Which of those 4 factors, sun, diet, age, or an underlying health issue, is probably the biggest variable influencing your body's needs right now? That's the factor that might make your perfect dose different from the standard 800 IU.
And that's the thing you should be ready to talk about with your doctor or pharmacist to make sure your approach is tailored, safe, and truly effective for you.
Stay informed, and wishing you strong bones and good health ahead.